If you Googled how to protect patient health information, the results that come up aren't helpful, especially if you aren't tech savvy. Maybe you're great with technology, however, if this is your first time figuring out easy ways to protect your organization's data, this Google search isn't going to help you that much. Modern day healthcare is a digital landscape. As a result, the results from the Google search I mentioned in the first sentence of this video end up being technical. In other words, you probably won't understand them unless you work in cybersecurity or IT. Yet, not every good practice for protecting patient health information in the workplace is technical in nature. There are some simple processes, policies, and physical items you could implement in your office today that would have an instant positive impact on your compliance environment. Hi everyone, I'm Matt from eTactics, and today I'm going to explain instant ways to increase and protect patient health information. Before we get started, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit that alert bell icon next to it as well, so when we post new helpful content, you get notified. The first way to instantly protect patient health information is to implement entertaining annual training sessions. If you follow HIPAA compliance, you know that it's recommended to give your employees training on its requirements in some capacity. Now, the specific rule within the law leaves room for ambiguity as to how often to hold training sessions. Most experts, though, recommend that you hold them annually. Yet, there's a big difference between holding annual training sessions and hosting an engaging learning event for your employees. Studies show that linking personal relevance and emotional engagement boosts memory storage. Thus, turning a training exercise into a series of fun games boosts your compliance while building camaraderie. The second instant way to protect patient health information is to implement a clean desk policy. No matter how paperless your organization is, printing out information won't disappear entirely. Further, some employees are so set in their ways that they'd rather have information they're working with in a physical format. In other words, it's not reasonable to ban printing at your organization altogether. Your patients might need helpful information like their prescription plan printed out for them. Instead, the only real option you have is to implement a policy that doesn't allow your employees to leave any printed material unattended. But the chances that your employees leave anything compromised on their desk severely declines the moment you implement a clean desk policy. Third, ensure that your software is updated. There's no denying that updating software regularly takes a lot of time. In fact, I'd wager to bet that you have software that needs updated right now while you're watching this video. However, not updating the software that you use on a regular basis could lead to a massive exposure to your protected and patient health information that you're in charge of. 60% of all breaches in 2019 happen as the result of unpatched vulnerabilities. So, that time you spend updating saves your patients and your organization in the long run. Fourth, back up your data. Before cloud computing existed, backing up your data meant purchasing a ton of external hard drives and requiring your employees to upload their work onto them at the end of their day. Many modern healthcare practices don't have to worry about backing up their data as much anymore because their EHR systems already do so through cloud computing. However, that doesn't mean that they're not operating without any risks if they use this option. It's a requirement that you back up any and all patient health information that you deal with as a healthcare organization. If you have a cloud-based EHR system, you shouldn't assume that your IT department enabled backup processes. Make sure that they're in place yourself. Fifth, install access control systems. Do you know who's coming in and out of your building on a given day? Sure, you likely have a sign-in sheet for visitors and maybe even your patients in your waiting room. But are you keeping track of employees coming into the secure side of your office? All that's required to do so is to install access control card readers at doors. Once installed, give each team member a key card that allows them to enter. These systems automatically log the activity at your physical location. Furthermore, if one of your employees loses their key card or it gets stolen, you can deactivate the card to ensure that the person who stole the card can't get into the sensitive part of your building. Finally, communicate on a need-to-know basis. Now, I know what you're thinking. The title of this section of this video makes it sound like you're working as if you're a spy for a top-secret wing of the government. A need-to-know atmosphere is an easy yet vital part of your effort towards protecting patient health information. Your staff needs to understand that they can't ever discuss a patient among themselves, their friends, or their family. When they do give out information to a patient or their family member, they need to be sure to whom they're speaking to. Protecting patient health information is a big responsibility that's placed on you as a healthcare organization. You have to ensure that the data that you're working with stays protected. That's part of your job. Yet, not everything you can put into place at your practice has to cost you so much and/or take months to install and learn. There are simple, fast, and easy methods you could put into place today that would protect your data in the long run. So what are you waiting for? If you'd like to learn more about ways to protect patient health information, reach out to eTactics. And you already made this far into the video, so you might as well like it, share it, and comment below. Well, what are you waiting for? Subscribe to our YouTube channel.